So, good morning, and now we are going to discuss about the anticoagulants. Now, coming to the anticoagulants are the agent which used to prevent the formation or the growth of the fibrin or the erythrocyte thrombi in the venous circulation. So, these are the drugs which will inhibit the formation of the growth of the fibrin and the erythrocyte thrombi in the venous circulation. They are not useful for the treating of the atrial thrombi, which mainly composed of the platelet aggregates. So, may not be helpful for the platelet aggregates, those thrombi. You can say that dissolving, but they are useful. You can say that to dissolve the fibrin. Now, anticoagulants, it is commonly known as a blood thinner. They are the chemical substance which prevent or the reduce the coagulation blood, prolonging the clotting time. So, they are increasing. Clear? They will be preventing the, you can say that, coagulation of the blood and prolonging the clotting time. So, already we have seen the clotting mechanism, which is occurs by the three pathway: vascular sperm, platelet plaque formation, and coagulation. And also we have seen the stages of the blood clotting, that is the formation of blood clotting through the intrinsic pathway, extrinsic pathway, and the common pathway, and the production of the insoluble fibrin. Now, mainly these are the drugs which will be act on this particular clotting, inhibiting the blood clotting coagulation mechanism. That they are inhibiting the coagulation mechanism, and what they will do, they will, you can say that, stop the formation of the insoluble fibrin. That stops the formation of the insoluble fibrin. So that is their main effect, and they may be used into the different disease condition. Now, classification of the anticoagulants. Now, anticoagulants which is used into the in vivo parenteral, Now, in case of the parenteral anticoagulants, indirect thrombi inhibitors, indirect thrombi inhibitors like heparin, low molecular weight heparin, danaparoid. So this is another one of the important drugs are used. Next is direct thrombi inhibitor, and that is the lepirudin. That is, next one is the bivalirudin. So these are the drugs are there. Next is oral anticoagulant. Clear? Oral anticoagulant, like you can say that coumarin derivatives, dicumarol, warfarin sodium. These are the drugs are very important. Other than this, you can say that edandione derivatives like phenindione, then direct factor 10A inhibitor, that is the rivaroxaban, and oral direct thrombi inhibitor, that is the dabigatran. So these are the drugs are there and used in vivo. Now, in vitro. Now, these drugs also used in vitro. It may be, you can say that, after collection of the blood, for the blood testing and all, because it will be there will be the clotting of the blood and all those cases we can use. Now, these are the things. It may be the heparin we can use. We can use the that is the calcium complexing agents like sodium citrate. Now, these are the different drugs we can either use in vivo mainly and also into the in vitro, which are the anticoagulants. So, in the next video, we are going to see about the what are the means mainly in the heparin and the warfarin, what is their mechanism of action, what is their use, and all the things we are going to discuss.